everyone. Me, Dr. Raghavendra Bhat, the senior author of this paper, the title of which is The Tale of Designing a Clinical Case Manual of Rotations and Mixed Methods of Analysis of Student Participation Experience in Co-Creation. Introduction. The post-pandemic era ignited the concepts of virtual learning, enhancing a strong need for a specific clinical case manual of commonly encountered scenarios in internal medicine. In this article, we describe the process of creating a clinical case manual, the pattern of which can be followed for any other clinical science. Further, they report the participatory experience of students in co-creating this manual. Methods. The handwritten notes were taken down during internal medicine rotation by myself, the senior author, and were improvised and created into a digital version. The editorial group, which involved mainly student volunteers, participated in digitization and viewing the content, diagrams and flowcharts. We described the process of designing the clinical case manual for rotations in internal medicine, which included handwritten notes, review of notes, formation of the editorial team, digitization of the text and artwork, editing the manual and releasing the manual. It can be replicated for any clinical science in rotations. In addition, the online survey with both quantitative and qualitative type of questions were asked to assess the students' participatory experience in co-creation. The results. The clinical case manual for rotations in internal medicine was released and received well. The online survey responses revealed that participating students benefited in terms of professional and personal development. There was an inter-item statistical difference, implying that all participants were agreeing or strongly agreeing to survey questions. All participants agreed on the usefulness of the manual. The main themes identified through the qualitative analysis were technical skills acquisition, lifelong learning and teaching, self-assessment, discipline, time management, teamwork and communication skills. In conclusion, the creation of a clinical case manual of rotation specific to local needs can be done through a systematic process that can be enriched by involving students. Encouraging the participation of students in co-creation is an important academic exercise that contributes to professional and personal development. I will show a few samples of this manual. This is the cover page, footprints. This is the editorial team, mainly consisting of the students. This is how the content is given in an index. This is how the cases are discussed with approach, which are highlighted important points. This is how the investigations like ECG is described in brief and concise way, and so is the X-ray in a brief and concise way. And this is how the lab approaches are given with explanation. Thank you.